Hi guys, so good morning from my side of the world. It is exactly 7:44 and I'm on my way to work. I decided to do this video for Friday's Doctor's Quarters on YouTube because the week has been crazy, busy on all fronts, and I figured if I don't do this whilst walking to work, yes, I might have to cancel posting a video on Friday. So here it goes. This is my work outfit, ready for work. I hope you can see well. Yes, so I chose this spot because I like it. It's cool here. The sun is out, so yes. And pardon me if this keeps shaking because I didn't pick a selfie stick, so I am holding this literally with one hand. So yes, you're welcome to my first timers and welcome back to my returning subscribers. Doctor's Quarters here, educating you on your health conditions, our health system and lifestyle. Yet to post anything lifestyle, but yes, it will come. So the outline for today's video is 1. What is a pap smear? 2. What is HPV infection? 3. Who needs to get a pap smear done? 4. What is the importance? Why is it so important that we get a pap smear done? 5. Some symptoms that HPV infection shows. Then 6. We share this video thoroughly and completely on all social media platforms to our friends and family, to as many people as possible. Let's get right into the video. Number 1, what is a pap smear? It is a screening test that is done on the cervix of a woman or a lady or a girl to determine abnormal cervical cells. It's a screening test done on the cervix of a woman, a lady, a girl, to determine the presence of abnormal cervical cells. That is what a pap smear is. Let's move on to the second. What is HPV? We are talking about HPV because the pap smear is to detect the presence of HPV in your system, the HPV virus in your system. So HPV is an abbreviation and it stands for human papilloma virus. It stands for human papilloma virus. So as its name says, it's a virus with many variants. It has hundreds and hundreds of variants, different variants causing different conditions in the human body. But today we're concentrating on the one that causes the cervical cancer, which is the HPV 16 and 18. So simply put, it's just a virus that gets into your system, forms attachments, continues to proliferate and proliferate until it causes cancer in your system, especially the variant 16 and 18. Number 3, who needs a pap smear done? This video is for the girls, it's for the ladies, it's for our mothers. Yes, so any lady 21 years and above, so from 21, 30, 40, 50, who is sexually active needs a pap smear. You need it. It is not a want. It is not luxury that I cannot afford it. You need a 21 years and above sexually active female. You need the pap smear done. Not to say that our men do not have the HPV living with them. They do actually, but the HPV's characteristic is attachment. When it enters into your system, it attaches itself to your sexual organ. But the way the male organ, the penile organ, is characterized, or the way it is made, it makes it very difficult for the attachment of the HPV virus. So they just carry the virus with them. They never show symptoms. It never causes any disease process in them. They only carry it, and then when they come into contact with you, a woman, and they have sexual intercourse with you, they pass it on to you. And our sexual organ makes it very easy for the attachment of the virus. So there you have it. So that is who needs an HPV. And then we come to why do you need it? I said it is a necessity. It is not a want, it is a need. You and I need an HPV. The reason being that I said from the beginning, it is a screening. And anytime we say screening, then we're talking about primary or even secondary prevention. We're talking about catching the disease before it starts its process. Either it's not there at all, right, but we do the screening, realize that it's not there, and then we prevent it from coming in, or primarily we catch it at an early stage, early stage, and then we cure it so that it does not end up in what we call the cervical cancer. Have you heard of it before? Let me know in the comment section below. Cervical cancer, pap smear, HPV. If you have heard of it, or you've read about it, or if someone has told you about it, let me know in the comment section, and let me know if after you were told it influenced your decision on some health matters. I don't know if it did or not, but let me know. So that's what I'm talking about, that this screening test catches this HPV infection at its lowest. The interesting thing about this virus is that when it gets into your system and it settles down, it attaches and all that, it takes 15 to 20 years for it to manifest as a full-blown cancer. That is amazing. Most of these cancers get into your system and quickly they are like in a hurry to proliferate and show off. But this one has a pre-cancer stage, 15 to 20 years old. In immunocompetent people whose immune system are strong and they are fit, it takes 15 to 20 solid years before it will get to a full-blown cancer. So why would you and I not go and screen today? So that if it's at its early stage, it is caught and dealt with. Because you and I know when we say cancer, it means death, it means chemotherapy, radiotherapy, it means financial difficulty, it means that emotionally you and your family, the people around you, are going to be in pain and distress for a while, and eventually death. It takes away your joy. You'll be going through chemotherapy, but you'll be vomiting always, your hair is off, you are weak always, all these things. The reason why it is important is because it catches this HPV at that early stage. Sometimes you will go in and your cells are normal, your cervical cells are normal after the HPV test, and then you are given a vaccine to prevent you, like COVID-19 vaccine, like polio vaccine, all these things, so that you don't even get it in the first place. It is very important. When you go and you test you get the pap smear done and it's normal, you're asked to come back in 2 years. The reason being that I said it's progressive. So maybe today it just entered your system, or it's now showing off, so we might not see anything. By 2 years time, if only you have it, it will show something, right? So that it's taken up on. I know HIV, we have HIV at heart now. People are worried about syphilis, gonorrhea in their partners and all that, but it is important. HPV. Why am I so passionate about this? I always bring you these videos based on things that happen in the week when I go to work. And this time I lost a patient to cervical cancer. She spent just 2 days with us. She was 42-year-old, and she had no clue that she had it. Just had some signs and symptoms, but as we know, we go to the pharmacy, get medicine, and it feels like it's gone, but it's not gone. Until she came to us, we detected it, but it was too late. It has spread all over her body. We could just make her comfortable for 2 days, and she died. This is very, very preventable. If it is not prevented, it is curable in the early stage. That is why it's very important that you get it. Let me not forget to mention, I spoke about a 21-year-old and above needing the pap smear. The vaccine is good for usually those who haven't had sexual intercourse yet. So we say from 14 to 19 years, you go to your doctor and you are given the vaccine and you are free but from 21 years and above sexually active, you need the pap smear so that we are able to know if you have it or not, and then your doctor knows how to proceed with you. If you have HPV infection, especially the 16 and 18 that causes the cervical cancer, what are some of the symptoms that you would experience? Deep pain during sexual intercourse. Deep pain. Sex is meant to be enjoyed, but there are people who groan, they are in pain throughout. I spoke about the vaginal candidiasis and superficial pain. This one gives you deep pain. Secondly, you would bleed after sexual intercourse. It is not normal. Don't take it as normal and just clean yourself up and go and get some amoxicillin or some antibiotics. No. And also it gives you foul smelling vaginal discharge. Vaginal candidiasis will give you discharge that is not foul smelling, but that of pre-cancerous, pre-cervical cancer stage, or even at the cervical cancer stage, you will get discharge that is foul smelling. Don't go to the pharmacy and tell them that you have white or candida or the yeast infection, and they will give you something to just clear it, and you feel like you are okay, only for you to present to us in late stage cervical cancer. No. So these are the three things. If you are experiencing them now, quickly rush off to see your doctor. Let them take it up from there, and then you can treat it. It is treatable. Let's not panic. I always say this. Just go there, get the test done, and let's see. If you don't have it, thank God, you'll be asked to come back. But even giving the vaccine before you are asked to come back, and if you've already contacted it, then treatment is commenced, and then it doesn't get to a late stage where nothing can be done about it. Thank you guys so much for watching this video. Please share the video. This information is important. I was talking to my boss today, and we were discussing that cervical cancer awareness, it is gaining momentum, but it hasn't gotten there yet, because I do that all through the week. As many patients, women that I see, I ask all of them, do you know about it? Some do know, but it's not a big deal. Some don't even know about it at all. So share this video to as many people. If you're a man, a guy watching this, your sister needs it, your mother needs it, your girlfriend needs it, your wife needs it, your friends, female friends, they all need it. And so we've come to the end of this video. I would see you in the next one. Please don't forget to subscribe. It's very important, and like the video. It tells the system that the video is of value, and then it's shown to as many people, and your notification button, so that anytime I put up a video, you'll be the first to know. I'll see you in the next video. Bye.